You're in your 80s? What now? Well, it's time to start thinking about what you want your life to look like for this next phase. And here are some things to consider when you're navigating health in your 80s. Hey there, it's me with a home care agency. Today we're talking about health issues in your 80s. First up is managing multiple chronic conditions. Multiple chronic conditions is a condition unto itself. As we age, we all become more susceptible to chronic conditions, which can range from diabetes, heart disease, or arthritis to cancer, Alzheimer's, and Parkinson's. As these conditions progress, they may require more management and attention. Fortunately, technology has made this easier than ever before. There are apps that can help you track your medications and symptoms. Devices like smartwatches can monitor things like your heart rate and blood oxygen levels. But perhaps the best thing you can do is make sure you have a strong support system in place. This could be friends, family, or even a professional caregiver. They can help you manage your day-to-day tasks so that you can focus on taking care of yourself. If you're already feeling overwhelmed by your current conditions, don't wait to get help. Reach out to your local senior center or area agency on aging to see what resources are available in your community. Another concern is preventing falls. Falls are a leading cause of injury and death among older adults, but there are steps you can take to reduce your risk. First, make sure your home is safe. This means removing tripping hazards, installing grab bars in the bathroom, and getting a physical assessment done through a home care agency to assess fall risks. You should also stay active, and balance exercises such as Tai Chi can help improve your stability and reduce your risk of falling. Finally, make sure you have a plan in place in case you do fall. This includes knowing how to call for help and having emergency contacts programmed into your phone. Next is staying socially connected. Social isolation is a growing problem among older adults, but it doesn't have to be. There are plenty of ways to stay connected to friends and family, even if you're not able to get out of the house as much as you used to. One way to stay connected is to use video chat services. This is a great way to see family and friends face to face, even if you're not able to be in the same room. Another option is to join a club or group based on your interests. This is a great way to meet new people and stay active. And finally, don't forget about the power of simply reaching out to people. A quick phone call or text message can make someone's day, so don't hesitate to reach out to loved ones or neighbors just to say hi. Staying connected to others is essential to maintaining your well-being as you age. Social isolation has been shown to have negative effects on both physical and mental health. But fortunately, there are plenty of ways to stay connected to others. Even if you're unable to leave your home as much as you used to, by making an effort to stay connected, you can help ensure that you maintain your well-being as you age. Now, maintaining a healthy diet can be difficult as we age. It's common for older adults to have difficulty preparing meals, but it's important to remember that eating well is essential to maintaining your health. In fact, studies show that eating a healthy diet can help prevent cognitive decline and reduce the risk of falls. So what does a healthy diet look like for an older adult? It's important to focus on eating plenty of fruits and vegetables, as well as lean protein sources, such as fish or chicken. You should also make an effort to eat whole grains and cut back on processed foods and sugary drinks. If you're finding it difficult to prepare meals, there are services that can help. Many communities have meal delivery programs that can bring healthy meals right to your door. Or you could try using a meal kit service that delivers pre-portioned ingredients and easy-to-follow recipes right to your doorstep. No matter what you do, make sure you prioritize your nutrition as you age. It's one of the best things you can do for your health. All right, let's talk about managing medication. As we age, many of us end up taking multiple medications to manage our various chronic conditions. But this can be tricky, especially as our health needs change over time. And that's why it's important to find a medication management system that works for you. One option is to use a pill organizer. This can help you keep track of which pills you need to take and when to take them. You could also try using a medication reminder app on your phone or computer. These apps can send you alerts so you know when it's time to take your medicine. If you're still struggling to manage your meds, don't hesitate to ask for help. Your doctor or pharmacist may be able to suggest additional resources or strategies that can help make things easier for you. With a little effort, you can find a medication management system that helps you stay on top of your health. Next up, dealing with incontinence. Incontinence is a common problem among older adults, but it's one that can be dealt with effectively. There are treatments available that can help you regain control of your bladder function. The first step is to see a urologist who can help you identify the underlying causes of your incontinence. Once the underlying causes have been addressed, your urologist may recommend a variety of treatment options, including medications, pelvic floor exercises, or lifestyle changes. In addition, there are also assistive devices that can help, such as absorbent pads and underwear. Don't let incontinence get you down. With the right treatment, you can regain control and live your life to the fullest. Another concern is memory loss. Memory loss is a common concern for many older adults, and for good reason. After all, it's a normal part of the aging process. However, that doesn't mean you have to just sit back and accept it. There are things you can do to help improve your memory and keep your mind sharp as you age. One of the best things you can do is stay mentally active. This means keeping your mind sharp by doing things like puzzles, reading, or socializing. You can also try taking classes or learning new skills. Another thing you can do is to pay attention to your overall health. This means eating a healthy diet, exercising regularly, and getting enough sleep. When you take care of your body, you'll also be taking care of your mind. Finally, don't be afraid to seek help if you're struggling with memory loss. There are resources available to help you cope, and there's no shame in asking for assistance. Remember, there are things you can do to help improve your memory and keep your mind sharp as you age. And last but certainly not least is dealing with mobility issues. Mobility issues are a common concern for older adults, but they don't have to keep you from living the life you want. There are assistive devices and technologies that can help you stay active and independent, such as canes, walkers, wheelchairs, and physical therapy. Canes and walkers can provide stability and support, while wheelchairs can help you maintain your mobility if you're unable to walk. Physical therapy can also help you strengthen your muscles and improve your balance. In addition, there are also home modifications you can make to help make it easier to get around, such as installing ramps or making wider doorways. If you're struggling with mobility issues, don't give up. There is help available, and there are things you can do to make things better. We understand that aging is a unique journey, and we're here to support you every step of the way. Please share your thoughts and comments below. We value your input and would love to hear your thoughts. Don't forget to like and subscribe for more helpful content. Stay healthy and happy.